During the month of November, folks are putting down the razor and growing out their hair in order to bring awareness to those who are battling colorectal cancer, the second leading cause of death here in the U.S., according to the Centers for Disease Control and Prevention. This month, ABC 7's Justin Hobbs is putting down the razor as well as part of the No Shave November. Today, he introduces us to one of those organizations benefiting from this whole campaign.
In 2007, I lost my grandfather to colon cancer. This is a story that, like many of you, may have experienced, either losing a loved one to cancer or maybe you yourself have battled cancer. Well, for the month of November, I'm participating in No Shave November. I'm growing the beard out to not only raise awareness of cancer, but also to raise funds for multiple organizations. One of those, Fight Colorectal Cancer. This is their story.
My family unfortunately lost my dad to colon cancer at the age of 57 in 2008. It was something that completely rocked our entire family. I grew extremely angry that I lost my dad to a cancer that is 90% preventable.
Colorectal cancer. It is the second cancer killer in the United States. Yet, it is 90% preventable through proper screening.
The stat that is on the horizon is by 2030, colorectal cancer will be the #1 cancer killer for people under the age of 49.
The screening age lowering year after year.
This past year, the screening age range was actually lowered from age 50 to 45 across the board. We're trying to understand the why. Why is this happening?
But campaigns like No Shave November are helping make a stride for organizations like Fight Colorectal Cancer.
It has been able to amplify our efforts on the policy level. We were really big on federal policy changes, but over the past 3 years, we've really dived into local state legislation. Again, making sure that there's no barriers to screening, there's access to screening for people. So it's really helped amplify our policy efforts and also our clinical trials finder.
These clinical trials helping us get one step closer each and every day.
Really get out there. If you've been screened, share it with your friends and family. More people are inclined to be screened if they know someone who's gone through the screening as well. There's multiple ways of screening out there, so just speak to your physician and find a screening that fits you. But get screened. It's really important and vital. My mindset each and every day that if I can prevent this from happening to one family, I've done good by my dad.
Well, 1 in 46 men will be diagnosed with kidney cancer in their lifetime. For women, it's about 1 out of 80. Now, the typical age for someone to be diagnosed with kidney cancer is age of 64, so it's fairly uncommon for those under age of 45. And this is why Bruce Hill's case is quite a unique one. This is his story.
I have 2 children, a wife, a good job, a good home. And now all of a sudden, my outlook of potential length of life has just gotten very short.
Bruce Hill was like any other active and healthy man in his 40s, but then all of a sudden
came up with anemia on a routine blood test.
Something quite uncommon for a male like himself.
Eventually, I was put on an iron supplement to kind of boost my hemoglobin, and that worked.
It seemed to be he was in the clear, but then fast forward 2 years later.
Early 2017, and we went on a family trip out to the western mountains ranges and did a bunch of hiking out there, Utah, Colorado, those areas, and I was really having a hard time keeping up just with my family, right, and just catching my breath. You can blame the altitude, but it was more than that, because I was in good shape.
He developed night sweats and pains, so his doctor ordered for him to get a CAT scan and an MRI.
So in May of 2017, I got the phone call, I need to see you today. I saw the doctor and he said there's a large mass on your right kidney. Most likely it is cancerous, and there are several spots in your lungs. That means it has metastasized to my lungs, makes it stage 4. Stage 4 often sounds like it's the kiss of death. It really just means it has escaped the original tumor and has spread somewhere else in the body.
So the doctors decided to remove his kidney, as it was the common practice at the time. Later, he went under an immunotherapy combination for the returning pop-up cells. But new practices and treatments have continued to emerge thanks to the push for research by organizations like the Kidney Cancer Association.
Over the last several years, things have gotten better, where there have been many developments in the treatment of kidney cancer. Today, I feel great. I'm doing very well. My health is good. I'm back in good shape.
Just imagine that your spouse or even your significant other came down with cancer, and then after winning a long, hard fight, you come down with the disease as well. This is exactly what happened to Jeannie Smith and Bruce Winter. This is their story.
She drove me to all of my radiation treatments, to the chemo treatments. She went and got, seemed like 1,000 prescriptions.
As he said, you took care of me, it's my turn to take care of you. And so it did work out, both of us, for me understanding it. And I think, as I said, most women tend to get very emotional when it's breast cancer. And Bruce, having had it, made it a lot easier on me.
It's the story of two lovers who both came down with cancer.
It started out as like a catch in my throat. He says, well, that doesn't sound good. He said, let me take a look real quick. He did, and he says, well, I've got bad news for you. He says, you have throat cancer. And I mean, that just floored me.
My doctor said, something suspicious here, let's go get you a mammogram. And from there, it snowballed into the point where I was found to have stage 2 breast cancer.
Bruce diagnosed in 2015, and Jeannie diagnosed in 2019. Both of them went through various treatments while also battling lonely and dark times. This is something Bruce almost felt that he was trained in from his time of working in Antarctica.
I think what it did for me was it helped me with the solitude that I had, having had the experience in Antarctica and not being out social as much, to have those 6 months that I was, pretty much confined to the house.
But today, they are doing much better.
I'd never smoked, so I had a 90–95% of full recovery, whereas if I had been a smoker, I would have had less than 55%.
We're never really cured of it. No one is ever cured of cancer. We just have no evidence of disease. And someone compared it to, there's always something off in the shadows lurking. Every time you go for a test, every time you go to a doctor, you're still expecting it.
And now they use what they learned from their experience to help others here in the Suncoast community.
Now, if there are people who need that kind of support, we try to be there for them because we know how important it is to have support.
Please get your test. Go to your doctor. See, every time they need something done, go see your doctor.
And we are glad to see that Jeannie and Bruce are both doing well. Now, if you'd like to donate to the No Shade November campaign, you can find a link on this story on mysuncoast.com. And coming up next week, you're going to hear from a mother who lost her son. It's a very heart-touching story, and what she is doing now to continue his legacy. And as we start to wrap up this series, tonight we're sharing the story of a young boy who lost his life too soon. This is Brody's story.
Brody was a boy through and through. He was very compassionate, but when he did speak or say something, he was kind of profound.
Brody was like any other young boy, excited about life and ready to join the football team.
He had waited an entire year to play tackle football with his best buddy, Chase. It is actually through football is how we found his brain tumor.
But Brody started to not feel good, so his parents took him to the doctor, where they ordered a CAT scan and eventually an MRI.
The doctor came back and gave us the news that, as a parent, you're never prepared to hear, and that was that your child has a brain tumor. After the surgery, our surgeon told us that it was the size of his fist, and he told us, he said, it is an absolute a miracle that Brody could do football practice.
He went through radiation and chemotherapy and fought very hard as he continued to go to school to see his friends, to tell them exactly what he was going through, while also making new friends through Cure the Kids and the Pediatric Brain Tumor Foundation.
He would see other children and meet other children that in his mind looked like him.
He made it through all of his treatments, but the day came back for his checkup, and they were about to receive the news they didn't want to hear.
He had progressed, and it had come back with a vengeance. It had spread all over his brain and all down his spine. So from there, it was really just maintenance and memory making. But in true Brody style, he was determined that he was going to finish second grade, and he did. He finished second grade the first part of May, and 2 weeks later, he passed away from his brain tumor. At night, when we would pray, he would never pray for himself. He would pray for all the other children that he met that had a brain tumor. And he asked me one time, Mom, why do I have this? Why do I have it? And I didn't know exactly how to explain it to him. And I just told him that sometimes special people are called for special purposes and that he was very special.
A special boy who is still touching the world as his mom carries out his legacy by working for the foundation that helped them.
I'm fortunate. I count it a complete privilege and honor that I get to work at this foundation because I get to pay it forward, for Brody. I truly believe if he was still living today, he would be right here beside me and we would still be working in this and paying it forward.
Now, if Brody was still with us today, he would now be in his 20s, and we appreciate Tammy not only sharing his story, but carrying on his legacy. And you can still help by donating to the Cause to No Shave November campaign, which you can find a link to on any of the No Shave stories on mysuncoast.com. Next week, we're going to close out this series by discussing the COVID pandemic and how it has impacted cancer.
Yeah, our Justin Hobbs has been sharing the stories of those on the Suncoast impacted by cancer. And tonight he shares his final story on how this movement is making a difference when it comes to research and prevention.
Well, today we are closing out our series on No Shave November. And as I do pick the razor back up, this doesn't mean the conversation ends right here. In fact, more and more cancer diagnoses are occurring each and every single day. And that number, it is only expected to climb substantially. A lot of this due to the COVID pandemic. This is the COVID and cancer story.
What's going to happen tomorrow? What's going to happen next week? As everything in their life continues to move around them and people age and things are happening, wondering what they're going to be there for the next event. Will they be around? Will they be going through treatment? Will that treatment, prolong things enough for them to do what they want to do?
These are just some of the thoughts that cancer patients go through. Then add the fact that the world decided to take a turn in 2020.
COVID in general is a terrible situation for about everybody on our planet, and it's that much harder for cancer patients.
COVID-19, it made it seem as though the world had stopped in time, as our daily activities and outings did. But in reality, the world didn't stop. Neither did cancer.
People have been putting off screenings, so tests are getting delayed and cancer cells are growing.
This lack in screenings has led to higher stage diagnosis in patients recently, and the director of the National Cancer Institute published in the journal Science that the pandemic will cause at least 10,000 excess deaths from just breast cancer and colorectal cancer alone over the next 10 years. And now the Omicron variant is on the horizon.
This has really been great timing, the No Shave November campaign, because we've seen a huge increase throughout the pandemic of financial need. As you can imagine, at one point we had an increase in grant requests up to 91%.
What it's done for our families is it has made an isolating disease even more isolated. We are so fortunate because of donors through the awesome opportunities like No Shave November. That's how we've continued to provide the level of support we always have to our families so that they did not get hit one more time with a crisis.
And this is why every dollar counts, helping these families in already tough times and funding further research in order to find a cure.
We want to see a future where cancer is not a problem. People can be cured when diagnosed. Not a death sentence. It's just something, that's a roadblock that they continue moving on.
Now, in addition to these hardships, cancer patients have a weakened immune system. This has led to higher risk when coming in contact with COVID. Because of this and because of the stories we have shared throughout the month, that is exactly why I grew the beard out. Now, if you're wondering what it looked like, the transformation, well, here is a look at the beginning when I was clean shaven, and here is what it looked like at the end. And you can see a full time lapse of the growth on my Facebook page as well as the ABC7 Facebook page. And what better day to end this campaign than on Give Back Tuesday. You can find a donation link to the cause on any of the No Shave stories on mysuncoast.com. In the studio, Justin Hobbs, ABC7, your local station.